may I now please call the team who is going to present their findings from the much wanted to hear SASA. SASA means now. Now is another word for a child as well. A child means now. So the title of their presentation is Promoting Gender Equality and Changing Social Norms. It's really going to be exciting because we are having three presenters co-presenting together with Tina Musuya, who is also one of the members of the workshop planning committee. She's an executive director of the Center for Domestic Violence Prevention in Uganda. And in summary, she's the everyday activist. We will also have Lori Michua, who is presenting here. When I read the name, I thought I know her because then I discovered that I've actually read quite a number of papers and things. She's an human rights activist, and she's the one who is actively involved and made the program tools for SASA. She's in East Africa for almost 20 years now, and she's the co-founder and co-director of Raising Voices in Uganda. And the next one is Charlotte Watts. She has been introduced before here, and I Googled briefly her publications, and I think you are outdated. There are not 120, there are more than 120. She's a professor in social and mathematical epidemiology at the London School of Hygiene and Tropical Medicine. So please welcome for your presentation. 20 minutes, maximum 25 minutes. Remember the prize.
Morning, ladies and gentlemen. My name is Tina Musuya, and I'm really happy to be presenting today. The SASA presentation is going to be done by the three of us. Lori and I will be talking about the program side, and Charlotte will be talking about the details of the study. So SASA, I know everyone is waiting to know what it is. SASA is a community mobilizing program that is about preventing violence against women and HIV and AIDS. And it was a collaboration between Center for Domestic Violence Prevention, which is a local organization here in Kampala, and Raising Voices, and the London School of Hygiene and Tropical Medicine. So the three of us go together. Today we are talking about the SASA study. This is about exploring community and relationship change. SASA, as you can see, is an activist kit. Big as it was designed to support it was developed by Raising Voices, and it's a community mobilization approach, which is about changing social norms that perpetuate violence against women. SASA in Swahili means now. Now is the time to prevent violence against women. We can't wait any longer. And as you can see, this SASA is also an acronym for the community mobilization approach. When you're talking about social norm change or behavior change, it's a very big process, very complicated. And therefore, it's not just a one-off activity. It has to be defined, structured in a very systematic way. And this is what SASA is about. So I'll tell you how the approach works. As you can see that toolkit, those are 4 folders broken into stages of community mobilization. So the first S stands for the start. The first S stands for the start phase, which is about learning about the community, it's also about the organization, the programmers themselves, because we shouldn't assume that the programmers have transformed. So it starts with the programmers, really to help them unlearn what they know, the issues that they believe in about women and men, issues of violence. So it starts with staff themselves, and it also goes forward to select community activists. Remember, the change is going to be happening at the community level. So you have to go identify men and women. Remember, men and women who should be in charge of their process of change. So this is what the start phase is all about. And it's also about fostering power within staff and the community activists. You know, SASA approach is helping us to start reflecting and challenging how we think about men, human rights, injustice, and discrimination. And the language is about power. So in this start phase, that's when the activists themselves start to think about power. How do they have it? How do they use it? What does it mean to use power with others? What is violence against women? And a lot of that is covered during that start phase. And it's also about making connections with the community where you're going to work. That's quite important. With the local leaders, the men and the women, the institutions within that particular place. Then the second phase, remember, the process has to be a little bit structured, not a little bit, really structured, because it's a complex one. The second phase, which is letter A, is awareness. And here, this is where a lot of work has to happen. It's about helping activists gain confidence. Remember, there are going to be challenging, very difficult things. All of us here, if you ask someone, just go talk to those stranger people about violence, you will freak out. So it's about gaining confidence. It's also about the language that Professor was talking about. What kind of language do you use that is going to make people connect with the problem? So, and then it's also about the informal activities. This SASA is a community model which is really based on diffusion. It diffuses through the communities. So these men and women are trained and mentored to reach out to their peers, friends, workmates, and colleagues. Oftentimes, the people we know are the hardest to talk to. So these community activists are mentored to do that. You start with your family members, friends, and so on. It's also about encouraging critical thinking about men's power over women, how it harms us, and the benefits of nonviolence, and the consequences of violence, and the connection between HIV, violence against women, and women's increase to HIV infection. Then the third phase is called the support phase. Here it's about strengthening skills and connections between community members. One thing that is very unique with SASA, it goes beyond awareness raising. Because often people are raising awareness, but when people are aware, what are they going to use their awareness for? They need to move on. We shouldn't stagnate. So the support phase is about helping people to gain skills. How do you talk to people who are experiencing violence? How do you support those who are changing? How about the activists? How do you support them? How do you join power with others so you can work together to create this change? Then the last phase is called the action phase. This is about trying new behaviors and celebrating change. When people know and they've learned the skill they need and they've known alternatives, they need to try out new behaviors. And it's really about fostering the power to make positive change. All this, we aim at reaching a critical mass across the social spectrum. So within this SASA, we have everyday men, local leaders, people, police, healthcare workers, the policy makers within that particular place, and the media. Everyone is really involved. We try to reach a critical mass. One thing that you have to also know about SASA is we use various strategies within, they are all embedded within here. One of them is local activism, which works with the grassroots people, and they use a lot of activities that, to reach out to others. There's door-to-door conversations, quick chats, community theater, Ludo games, outreach. There's so many informal activities in there. Then there is the training. This SASA has training modules right from the beginning up until the end, specific to each phase. And these are trainings that are very reflective. They help people to, first of all, increase knowledge, challenge their attitudes and belief system, and also gain skills. That's very, very important, because just knowledge alone, you're stuck with it. You don't know how to use it. SASA makes that difference. Then the next strategy is media and advocacy. And the last one is communication materials. So the content is different. The content evolves as per phase, but the activities are similar across the 4 phases of community mobilization. Quick things that, as I'm summarizing, there are 3 critical components of SASA. One is the process. This SASA shows that phasing in ideas systematically is very, very important. You cannot just give everyone too much, but it helps when the ideas are phased in a systematic way, and work has to be led by community members themselves. Then the reach is also important. It's important that we have to create a critical mass across all the sectors. If you work with individual women alone or men alone, it's not as effective. And we also found, we use multiple strategies for intense exposure. If you can't catch someone at the community, at the bus station, then you might catch them in church or on radio or somewhere else. The content also is quite important. The language of power is very, very provocative, because people don't feel excluded. They feel like they are part of the conversation. It decreases defensiveness and also gets very personal. Is that my last? Okay. SASA in Kampala, we worked with 400 activists, men and women, who were based in the community, also local government leaders and cultural leaders, Sengas are the traditional marriage counselors, police, healthcare workers, and drama activists, plus the youth. They conducted over 11,000 activities, which were those ones, and they reached more than 260,000 community members in 6 parishes in Machindye and Rubaga division here in Kampala. Thank you.
Okay, I'm number 2 on the tag team. So moving on to the trial results, just to give you a sense of what's new about this trial is that we're getting a growing body of intervention evidence that tells us that we can prevent partner violence. At the moment, what this evidence largely does is say, let's do a group-based intervention with a number of people, and then we look at those people, or we look at those people's partners, and we say, have those things changed for those people who are directly exposed to the intervention? So what we did here for SASA, what we were interested in is saying, how can we move beyond this and look at, can we actually prevent violence at a community level? So this is the first cluster randomized controlled trial that we know of that has tried to look at, can we prevent community level levels of partner violence and related outcomes. So to give you a sense of the methods, we did a cluster randomized controlled trial with a baseline and follow-up with sort of more than 1,500 respondents at baseline, 2,600 respondents at follow-up. We did complementary qualitative research, we did operational research, and we also did an economic evaluation, a costing study. I'm going to focus here on presenting you the quantitative data, but there are also a number of other publications and outputs that are in press related to some of the other aspects of the trial research. In terms of our design, we had a cluster trial design. So we had 4 intervention sites and 4 control sites. So quite a small number of clusters when in trial terms. What we did, the map shows the particular sites. We had pairs of matched sites, and then we randomly allocated which site would receive the intervention at the start of the trial, and the other community would be waitlisted to receive the intervention at the end of the trial. In practice, the intervention ran for about 2.8 years of programming between 2008 and 2012. There was some political unrest and violence during the trial study, and so the programming was interrupted occasionally. But the data suggests that the intervention and control sites are highly comparable. I'm not going to show you that data because of time, but these sites were highly comparable. In terms of the outcomes, we looked at the SASA intervention logic model and said, well, what are the range of outcomes that this community-focused intervention is trying to achieve? And let's measure each of those. Because the thing about a trial is what you say is, let's define how we define success, and then see if that actually changes at the end. And so what we identified from the SASA model is 6 primary outcomes. 2 related to the acceptability of violence and women's ability to refuse sex. 1 on women's experiences of physical partner violence in the past year. Another on women's experiences of sexual violence in the last year. And we chose to separate them out because programmatically Tina stressed very much that it's harder to move levels of sexual violence probably within relationships than physical violence. And so we put sexual violence in there because it was an ambition of the intervention, but I put it in italics because we knew we probably wouldn't actually achieve impacts on it. It's quite a tough thing to move, but we wanted to reflect the program aims. We also wanted to look at, for women who had experienced violence in the past year, how appropriate did they feel the response that they'd received was, because that's an important element of the SASA programming. And because this intervention is interested both in violence and the links with HIV and HIV-related risk behaviours, we also looked at men's reports about sexual concurrency in the past year, so men who've had multiple sexual partnerships in the past year. Because it's a cluster randomized trial, we have to do a cluster level analysis. So our units are the clusters themselves. So statistically, that gives us an n equals 8, so quite a small statistical power. And what we did is look at our outcomes at the community level and compare at follow-up what do we see in our intervention versus our control communities. That's how we do trial analyses, controlling for any baseline differences. So very similar to the methods that were used in RACI. Our main analysis was an intention to treat analysis. So what that does is say what is happening at the community level, irrespective of whether people got the intervention or not, how good the community activist was or not. It's what do we see when we look at the intervention, sort of good and bad and everything. But we also looked at a per protocol analysis, and that's saying, well, what if we look at people who had a direct level of exposure to the intervention? Do we see differences when we look at those people who've had direct intervention contact? And for that, we used a measure called the sort of medium or more levels of SASA exposure. So they'd had more than seen a poster or one quick chat, but not highly, highly intensive levels of exposure. So to give you a sense of the intervention coverage in the study communities, this plot shows you the levels of the percentage of men and women in the intervention and control communities who report SASA exposure or medium levels of SASA exposures. What you can see is that in the intervention communities, men report much higher levels of exposure than women, which is sort of what we expect from a community-focused intervention, and very little reported exposure in the control communities, which was reassuring for us because this is a community mobilization intervention. We were slightly worried that there might be diffusion into the control communities, but this data doesn't suggest that that happened. Moving on to the results, I'm going to go through these quite quickly because I've got to go through all of those 6 outcomes that I told you about. So what we saw is less supportive attitudes towards the acceptability of violence when we looked at the intervention versus the control communities, and the data behind that is shown. And this was significant for female attitudes. We also saw shifts in the social acceptance that women can sometimes refuse sex. And we saw significant change both in male attitudes and female attitudes on this. We saw a large effect on past year levels of physical violence. So the past year levels of physical violence were 52% lower in the SASA communities than in the control communities. The figures for sexual violence were also lower in the intervention versus the control communities, but the difference was less marked. It was 14% in the intervention communities and 20% in the control communities. What's interesting about this is even though the effect size is very big, this impact wasn't statistically significant. And so people say, well, how come you can have such a big effect, but it's not statistically significant? Tina was asking me this very strongly. And I want to give you a sense of the data behind this, because this is the challenge with small cluster randomized controlled trials. So what this plot shows you is the data from each of our pairs of intervention and control communities. So the intervention communities are the blue bars, and the red are the control communities. And this is the data from follow-up. So you can see, if we look at site 1 and 2, the levels of violence are lower in our intervention and control. Similarly in sites 3 and 4 in our pair. Similarly in sites 7 and 8. But in sites 5 and 6, we had low levels of physical violence in both. And so that's the thing that undermined our statistical significance. If we'd had a large number of clusters, we'd be more resilient to that sort of effect. But because we've only got these 4 pairs, this is what ended up meaning that we haven't had a statistical significant result despite a 52% reduction in violence. Okay, moving on to the levels of sexual concurrency. There we saw statistically significant differences again between the SASA intervention communities and the control communities. There were still high levels of sexual concurrency reported in the intervention communities, but significantly lower than in the control communities. In terms of responses to violence, we saw, in terms of women's report about an appropriate response, higher levels of reporting of an appropriate response in the intervention communities than in the control communities. This again wasn't statistically significant, and we weren't surprised by the lack of significance because this applied to a small number of women who had actually experienced violence in the past year. But it's an encouraging result. So to give you a summary of our overall intervention effects, this plot shows you the effect sizes and confidence intervals for each of the outcomes that I've just run through with you. So the top block of data shows that all of the outcomes around community attitudes and responses to violence have improved, which is what we would hypothesize and hope would happen and that we're seeing. Most of those are statistically significant, the responses aren't. Similarly, if we look at the data on decreased partner violence and sexual concurrency, again, all our effect sizes are going in the right direction. The physical violence and sexual violence aren't statistically significant, and sexual concurrency is statistically significant. When we've got a small trial, one of the key considerations is how consistent are the findings across outcomes, and what this points to is a general consistency of findings, which I think adds weight to the case that this intervention is having its hypothesized effect. Moving on quickly to the analysis that looked at, well, what's happened amongst people who've actually had direct intervention contact. And this is a summary plot. Generally, we see very similar trends. And the thing that actually surprised me in terms of the effect size estimates was generally they were very similar size. So for most of the outcomes around attitudes, it wasn't that you necessarily had to have a direct intervention contact to change your attitudes, which is very supportive of the model of social diffusion that this intervention is based on. What's interesting is we look at that last bar on the bottom chunk the first chunk here, which is on community responses to women experience violence, actually here the effect becomes borderline significant and the effect size is much bigger. So to me that suggests that for women who've experienced violence, that direct contact with SASA was important and actually did make the effect more meaningful. In terms of our violence outcomes as well, our past year physical violence, the effect size is very similar, but it becomes borderline significance. Okay. So this trial has both strengths and limitations. I think the strengths are that it's the first trial to try and look at community impact of an intervention. We've had an excellent partnership with CEDAVIP and Raising Voices. They've really come into this. It's a brave step to say, okay, come and evaluate my intervention. We're going to deliver an intervention to some communities and we're going to hold off delivering that intervention to other communities. And they were brave enough to take that step and to work with us for many years and with a team based here in Kampala to do this research. We've used mixed methods, and so part of our analysis has also been to look at, well, how do the quantitative and qualitative data speak to each other? And I think because we're looking at a range of outcomes and thinking about pathways, generally we're seeing a lot of consistency in the data as we interrogate it. I think the challenges we faced, the programmatic disruptions around the violence that was happening in Kampala, was a real challenge at times, but still the intervention was delivered. We have a small number of clusters, and so that's limited our statistical power, and that's a challenge in the interpretation. And as in any other violence trial, we're reliant on self-reported outcomes, but careful attention was paid to how do we ask women about the experiences of violence and to provide appropriate responses when needed. So to end in terms of the conclusions, I think the findings do build a strong case that SASA has had positive community impacts. We've got significant improvements in attitudes towards the acceptability of violence and women being able to refuse sex. We're seeing substantially lower levels of physical partner violence in the intervention communities, but it isn't statistically significant. And when I get my trial epidemiologist to help me understand what this means, she tells me that there's 11% probability that this effect could have happened by chance. So Jackie's going, yeah. I think what's interesting is that we're seeing similar impact sizes in the per protocol and intention to treat analysis. So to me, that's very promising because it tells us that actually you don't have to reach everyone directly with your intervention to impact on everyone. And to me, that's where we need to go as a field to think about how do we do that more. So in terms of the learning for the violence research field, people yesterday saying what works, tell us, presenting data from syntheses of evidence. This field, particularly on partner violence prevention and also on responses, is very early. So we need to keep learning, refining and testing promising models of intervention. There isn't funding to do one intervention to achieve impact one person at a time. So we need to be thinking about what a community vote approach is to violence prevention. And I think in this regard, community mobilization and the model that SASA is using seems to be incredibly promising at providing a mechanism to achieve community level impacts. So I'm going to hand over to Laurie.
Okay, so I'm just going to try to wrap up quickly. I know we're running on time. So I'm just going to talk a little bit about the learning from programming. For those of you in the room who are not as comfortable with the numbers, you're our people, and so we're going to speak to you as well. So we can really understand, so what does this mean? Yeah, what does it mean when we develop programs? So a few things that we feel like are critical and really helped make SASA really an effective intervention. And one of the things is that we really feel that community-led activism rather than NGO-led activism really makes a difference. It means that people talk to people that they know, and people who are in the community already are talking to each other. And there's a level of trust there rather than having some expert or staff person come in from an NGO to give a little speech in the community at the market. It really makes a difference when it's just neighbors and people talking to other people. And it really, when you see your neighbor talking with conviction about something, as personal as this, it really can spur behavior change. We also have a real focus on critical consciousness. So it's not about messaging. It's not about saying the posters stop violence against women. That doesn't really help. How do you do that? I wouldn't really know how to do that, right, if I saw a poster with that. So we're really trying throughout all the phases that Tina described is to really help people understand and figure out for themselves, is this helping me and my life or is it not? Yeah, so we're really trying to help people think. So we ask a lot of questions. We don't do the traditional messaging. Another piece that we really try to focus on is a non-punitive approach, right? There's a lot of tension within this that men can feel very defensive, women can also, it can create a lot of tensions in the community, right, when we talk about violence against women. But what SASA tries to do is really say, actually, is violence helping your family? Is it helping your relationship? Is it making your relationship better, or is it not? And instead of kind of saying, you know, oh, these people are being violent, we talk about power, and power is in the next one of the points as well. The language of power has really shifted things significantly for us, because we used to talk about violence against women and the types and causes of violence, and it would stay very shallow, and it wasn't like about anything personal for anyone. But when we started talking about power, men were like, oh, I have felt powerless. Every one of us has felt powerless, yeah? Many, many times in our life. And we've also felt powerful. And so trying to talk about violence in a way that we can use our power positively or use it negatively really shifted the dynamics in the community for us and how people were able to really engage with us. And another small point is that really working with men and women together, that, you know, it came up yesterday about engaging men. SASA and community mobilization approaches like SHARE as well have worked for years with men and women, because if we're talking about social change, we learned that we can't just talk to women. And unfortunately, now it seems we're going through a process where we're learning we can't just work with men. And we're hoping that this gets us to the other side. If we're talking about social norm change, both men and women contribute to the social norms. So we have to be working with both. So what isn't working? One of the really interesting things that we found in SASA is that SASA talks a lot about gender roles. Men can do this, women do this, you know, how are you sharing roles at the household level? And it was actually like in the awareness phase, we were talking a lot about this, and we were getting strange like reactions from people. And it was actually causing quite a bit of tension within relationships. And we talked to the community activists and community members and said, what's up? Like, we thought that's a one way of expressing kind of shared power. And community members were like, I don't really care as much if he washes the dishes today and I do it tomorrow. I want him to respect me and value me. And the men were saying the same thing. I want her to understand if I only have 1,000 shillings for her to buy food that day, it's not because I'm a jerk or I'm trying to be mean. I don't have the money. And so people were trying to say to us, we don't really, it's important to share things, but that's not the critical part. And the critical part is that in a relationship, I feel valued and respected. And once we shifted that from, okay, who's doing the washing today and who's bathing the baby, it really opened things up for us and within SASA. We also found that the inclusion of many types of violence, often we do programming and we're talking about violence against women, and people talk about intimate partner violence, and they talk about early marriage, and they talk about FGM, and they talk about rape from strangers, and people are just like, I can't, it's too much. It's totally overwhelming. And so, but yet all of us have a experience of intimate partner relationships, even if we're not in a partnership, because we saw our parents or guardians or aunties, whoever. And so it's immediate. It doesn't feel far. So it kind of breaks the divide from like those people who are using violence to all of us are struggling with how we use power in our intimate relationships. And that shift really, we think was important. Okay, that's done. So some important learnings. We thought, okay, it takes generations. Like, we've been talking to donors for years, as I'm sure many of you have, and they think, oh, that community mobilization stuff, it's a bunch of dramas, it's going to take generations. But like 2.8 years, and we had kind of a hard 2.8 years. It was a little bit intense in Kampala at certain times, and we were able to make some real significant shifts. So we're really excited about that. But we could make those shifts because we didn't dabble. We were there, yeah? It was intense, we were focused. Community activists every day, people come and visit, set up and Raising Voice, and they say, oh, can you tell me when something's planned? We're like, well, you have a choice of like 15 activities today, because it's every day that the activists are out there. But it does require an organization not to play the front role, but the backstopping role. Yeah, and this is a role that is sometimes hard for organizations to play, but a backstopping role to trust communities and community members that they can actually lead the efforts. And that we really have to figure out and how to shift from like we're doing this project and we've got 2 years of funding to actually trying to inspire activism. Yeah, because if we really want violence to be prevented and violence to end, we really need to have people feel this issue personally and to inspire a sense of activism, not to keep thinking about NGO-led programs. Okay, so moving forward with SASA, SASA is now being used in the control communities here in Kampala and by many other organizations, some of you in the room, which is really nice, but in many countries in sub-Saharan Africa, from very large INGOs to very tiny CBOs to pretty much everywhere in between. It's also being used by the government of Uganda in 8 districts of Busoga to try to figure out how to go to scale within a government structure. It's implemented in very diverse settings, from refugee camps to pastoralist communities to urban centers to very rural Botswana. So we're seeing that if we have the core components that Tina talked about, the process, the content, and the structure of things to really reach out to people, that's pretty fundamental for quality programming. And then there's big adaptations underway. It's just been finished, actually. It's in print, a full adaptation in Haiti. It's also being used and adapted in Mongolia, and a major adaptation in Ethiopia, and also here with Chokra and the Catholic Church of Uganda for SASA Faith, for faith-based communities. So thank you. I see that there are many folks in the room who know SASA or work on SASA, and please, Josephine Kamisha's here. She's been a community activist for years. She's amazing. So chat with her, and also I should say that local members, our advisory committee, Dr. Kebonesa is also here, who helped us along when we did the study. So thank you to everybody. Yeah?